And joining us now, she is the Associate Director of the Swine Health Information Center. Dr. Megan Niederwerder is with us. And Megan, great to catch up with you again. Merry Christmas. Happy New Year to you. Thanks for joining us. I hope you're doing well.
Yes, Merry Christmas, Jesse. Glad to be here.
Appreciate the time, Megan. Let's dive right in. Got a couple things I want to talk about here today. Let's start with the 2022 progress report from Schick. I know this news just getting released and just kind of looking at the year that has been. And I know you guys have covered just so much with the Swine Health Information Center here. As you look at this progress report, can you go over some of the highlights for us?
Sure. So the 2022 progress report we just presented in front of the National Pork Board of Directors on December 15th, and they approved that progress report. And now it's available on our website for anyone to review. We do have an executive summary at the beginning, which is a shorter, more condensed version of the progress over the last year, and then more details throughout the report. It's really been a great year as far as looking at some of the research projects and their progress and their findings, and those findings really informing the industry as far as prevention of disease, preparedness and response, early detection of emerging diseases. Also, the Wean to Harvest Biosecurity Research Program was formed over this last year with the Foundation for Food and Agriculture Research and the Pork Checkoff. That's been a major effort of the Swine Health Information Center to really improve wean to harvest biosecurity in that phase. And then the other major disease that we've really been monitoring and having quite a bit of activity in regards to is Japanese encephalitis virus. That was a virus that was introduced and expanded in geographic range in Australia last year. And the Swine Health Information Center put together a webinar to inform and provide information to our stakeholders. And we also have funded research to look at what's the risk of introduction of that virus into the U.S. We're currently negative. We'd like to stay that way. But what are the highest risk areas or routes of introduction for that virus? And of course, what do we put in place to mitigate those risks? And then in October, we put together a symposium on JEV, trying to bring together federal and state animal health officials, academic researchers, the Australian producers and animal health officials to look at what should the U.S. do to not only prevent introduction, but to prepare a response document to know what we would do in the case of an introduction of JEV. So those are some highlights of the progress report.
Definitely. Well, and I believe in the report you guys mentioned and outlined with JEV how it could be compared to PED and that outbreak that we had with porcine epidemic diarrhea virus, and how JEV could be the next PED if we don't take steps to try and mitigate it and understand it here in the U.S.
Exactly. So when PEDV was introduced in 2013, we knew that it was circulating in other countries, primarily China, and that they were really having issues with PEDV. And when it was introduced into the U.S. in 2013, that first year of introduction, we had about 10% production losses of the pigs in the U.S. due to mortalities. And that, of course, virus affects those neonatal piglets. So we saw high death loss in those neonatal pigs, and it really impacted production. It impacted the number of pigs in the U.S. It, of course, cost the U.S. economically significant numbers of dollars because of that introduction. And today, we still battle that virus every day on the swine farm. It's really an endemic disease now, and one that we continue to have issues with. And so we know that prevention of entry of any new disease is really our best tool, but we have to also be prepared. And so when we think about JEV and its introduction and expansion this last year into new ranges of Australia, we have to up the increase our efforts to prevent that virus from coming into the U.S., because in Australia last year, it caused them about a 6 to 10% production loss. So those numbers are very similar to that first year of introduction of PEDV into the US. We don't want to see that again. And so it's different from PEDV in that it causes reproductive outcomes on the sow and breeding farms, more abortions, stillborns, mummified fetuses. But the other difference about it is that it's a mosquito-borne disease, so we have to think about mosquito control, and it also can infect humans. And so it's different in those characteristics from PEDV, but again, we're doing everything we can to try and prevent entry.
Megan, I want to talk a little bit about the Wean to Harvest biosecurity program you mentioned. I know recently you guys, the Swine Health Information Center, solicited for folks to recommend different things to study with that program. And I believe it was 40 some recommendations you guys recently got. Could you talk a little bit about that as well?
Yeah, so we released the Wean to Harvest Biosecurity Research Program call for proposals on October 18th of this year. It was a program formed in collaboration with FAR and Pork Checkoff, really based on vulnerabilities that we saw in the Wean to Harvest phase, higher PEDV rates of infection, higher PRRS virus rates of infection. It seemed like transportation played a major role in the APP outbreak this last year. So we formed this based on some of the data that we had analyzed over those first 6 months of 2022, released that call for proposals based on research priorities that had been formed by task forces made up of veterinarians and producers and allied industry individuals to really identify what's going to provide the most value back to producers. Where can we really make the biggest impact on biosecurity? And we gave researchers about 2 months to prepare those proposals and to come up with ideas that address the research priorities that we had published. And our deadline was last Friday, December 16th, and we received an outstanding response, 41 individual proposals for that research program, and very diverse proposals in both the funds requested, the timeline of completion for the project or needs, the institutions by which we received those proposals, and of course the topics. And so we're really excited. This is going to be a competitive process where we can review those proposals and really select again the proposals that are going to provide the most value to the industry. We do the selection process with a recommendation task force. So we put together another 2 groups of individuals, one for site-based proposals and one for transport-based proposals. Those recommendation task forces, again, made up of producers, veterinarians, allied industry, academic researchers that review the proposals, and then they make recommendations for funding. And then we work with the Swine Health Information Board of Directors, as well as the Foundation for Food and Agriculture representatives and Pork Checkoff to again select those proposals for funding. We're anticipating finalizing that process, or our goal is by the end of January next year. And then those projects would be started probably early February 2023. So we're really excited about the response that we received.
Well, Megan, before we run out of time, just to wrap it up real quick, a lot of great things you guys are doing with SHIC. And as we look ahead to 2023, we know diseases don't stop, obviously. African swine fever, of course, is an issue. We've talked about JEV. I'm sure PRRS is continuing to be an issue for some. PED is always out there as well. So as we look ahead to 2023, I would have to think those are issues and diseases that are remaining top of mind for the Swine Health Information Center. Is that the case, or is there anything else you guys are really watching out for as we enter the new year?
Yeah, I think you've hit a lot of the main points where, of course, global disease monitoring is an ongoing process, right? So we never know what the next disease potentially could be. And so continuing to monitor those global diseases as they come up, and also look for new syndromes. So when you think about a new disease, it could initially present as just an unusual clinical signs that are either unexpected or out of the norm of the baseline that you may see in your herd. we want producers and veterinarians to always be looking out for those clinical signs that may indicate that something new, either a new strain of endemic diseases or a new disease has entered. Again, one of our best defenses outside of prevention of entry is early detection, so that we can detect any new disease in the U.S. herd and prevent spread as much as possible. The other thing as we look into 2023 would be encouraging producers and veterinarians to review their biosecurity protocols. What's one additional step, biosecurity step or protocol that you could potentially add to your day-to-day operations that would better protect our industry? Because really, we're in this together, and each one of us plays a role in preventing disease across the industry.
Well, we appreciate the time and the thoughts. And again, folks can go to swinehealth.org to look at all the different research and the different reports, the progress report as well, and see all the great things that the Swine Health Information Center is doing. With that, we'll wish you a Merry Christmas, Happy New Year. Dr. Megan Niederwerder with the Swine Health Information Center. Thank you for joining us, and we'll talk to you again soon.
Thank you, Jesse.